Tilda, I don't much care for bloggy, vloggy intros to videos. You know what I mean. That thing that a lot of people do where they start a video and then they talk for 5 minutes about, oh, I'm so sorry, I haven't uploaded anything for a while, and I did this thing, and then I did that, and then this thing happened, and I'm so sorry, guys. Anyway, now I want to talk about, you know, that sort of nonsense. And then they finally get down to the point. Well, unfortunately today I'm going to be indulging in a little bit of the same bullshittery, because it's actually relevant. So I recently enjoyed a 4-day weekend, and since I had this 4 days off in a row, I thought I'm gonna go have myself a mini holiday, because why not? Get away from it all for a little while, spend a bit of time away from the internet and all of the nonsense that follows it. Just give myself a little bit of time to switch off from all of the gender politics, social justice, feminism, men's rights, MGTOW, all of that stuff could just be left until I got back. Oh, how wrong I was. So for this mini break of mine, I fucked off to a place in the UK called Oxfordshire. Went for a nice little spa break thing, spent a disproportionate amount of my time living inside jacuzzis and steam rooms, even went and got myself a slightly painful yet incredibly relaxing deep tissue massage. I was feeling pretty good, and then I went in to the city of Oxford. Now, Oxford City hates cars, and it's one of those places where basically really pretentious upper middle class is the baseline of society. Lots of hipsters on bicycles, lots of super trendy craft beers and artisan bread and cereal and bullshit places, and pretty much all of it is pedestrianized, which basically means you're very limited in how you can get around. You can either walk, you can cycle, or you can get the bus. And this is where I finally get to the point. Every single bus stop, and that is not an exaggeration, every single one of them carried this poster. Men, speak up to protect a girl at risk of FGM. Everyone can help. From oxfordagainstcutting.org. So some of you will be watching this and you will have had the exact same reaction that I had. Others of you will be looking at this with some slight confusion and saying, well, what could possibly annoy you about this? This is an organisation that wants to stop female genital mutilation. How could you possibly hate that? Well, let me explain. First, the UK is a country in which male genital mutilation is still legally permitted. And yes, I call circumcision male genital mutilation because that is exactly what it is. You are mutilating a person's genitals, very often a child's genitals, who cannot protect themselves and cannot consent. And we're going to be looking in this video at different types of circumcision for both men and women, and you will actually realize that female circumcision can be completely comparable to male circumcision. Secondly, about this poster, men, speak up to protect a girl, because it is, of course, the duty of men to protect women, because women are not complicit in this at all, clearly. Oh yes, we're going to be blowing that out of the water shortly as well. And finally, we're going to go on to look at where exactly female genital mutilation is coming from. Because this poster kind of skirts around the actual problem. So let us now cut straight to the point in regards to circumcision, female genital mutilation, and male genital mutilation. oxfordagainstcutting.org, and we're going to be going straight into their resources page, because this is really rather telling. The very first resource that they provide you is an infographic about the prevalence of female genital mutilation in Africa and the Middle East. That seems rather unusual for an organisation that is supposed to be combating genital mutilation in Oxford. But this is somewhat the tip of the iceberg that lurks beneath the surface on this entire issue. That this problem is largely imported. and that the wildly increasing rates of female genital mutilation in the UK is as a direct result of the large amounts of immigration from places such as Africa and the Middle East. And this is something which becomes quite apparent with a little bit of very simple join-the-dots logic. I'm sure we're all familiar with images such as this, generated using ONS data, that's the Office of National Statistics. In this instance from the 2011 census, the census which is now quite infamous for demonstrating that the ethnicity of white British is now a minority in the capital of London, both in terms of population and in terms of those born to foreign parents. And a quick look at the raw data shows that immigration from Africa and the Middle East accounts for 2 very large portions of the total immigration into London. Now, why do I bring this up? Why am I talking about the population of London when we're concerned with female genital mutilation in Oxford? Well, it's quite simple. We're now going to look at the rates of female genital mutilation by geographical region in the UK. This will bring us around full circle as to why Oxford is telling us about rates of female genital mutilation in Africa and the Middle East. Oh yes, that is a very definite pattern right there, isn't it? We just so happen to know that Africa and the Middle East have ridiculously high rates of female genital mutilation, and areas in the UK that have high rates of female genital mutilation also have very high rates of immigration from those areas. But I'm sure that's just a coincidence, and there's no actual link at all, because I wouldn't want to be a racist, oppressive shitlord. Well, never mind, FGM is clearly a problem, and we need to address it. And by we, I do of course mean men. Men need to address it, not women, just men. Especially since the Oxford Against Cutting initiative has defined in its strategic principles and aims that FGM is a violation of human rights, a form of violence against women and girls, and a form of child abuse. And none of those words could ever be applied to male circumcision, because reasons. Fortunately, however, Oxford Against Cutting has published a handy-dandy little leaflet so that the uneducated and quite possibly misogynistic plebs can understand why this is an important thing to talk about. What is FGM? I've never heard of it. FGM stands for female genital mutilation. It is the removal of the external parts of female genitalia. Some people call it female genital cutting or female circumcision. Type 1, when the clitoris or the clitoral hood is cut off. Type 2, when the clitoris and inner lips are cut off. Type 3, when the clitoris, inner lips and outer lips are cut and sewn together. Type 4, all other harmful practices including pricking, piercing, cutting, scraping and burning. And I'd like to now point out the very subtle use of Type 4, because Type 4 has been quite contentious, especially since it contains the use of the word piercing. And the reason that this is quite contentious should be fairly obvious. Genital piercing is a type of body modification, in the same way that piercing your ears is. As a result of putting the word piercing into this category, what this enables people to occasionally do is to include consenting adult women who have had aesthetic piercing done to their genitals as a part of the FGM number. And this is something you will want to keep your eye on whenever someone quotes FGM statistics at you, especially if those statistics include Type 4 FGM. And now time for a quick break and anatomy lesson, because I think it's really important that people understand the different kinds of female circumcision and the different kinds of male circumcision, and how they are in fact, in some cases, quite comparable to each other. Because frankly, I'm getting sick of these two issues being treated as if they are separate issues when they are in fact one and the same. So let's break out some medical diagrams and have a little look-see, shall we? So first of all, I think it's important for people to understand the origin of human genitals. This is something which we've actually talked about before on this channel in the video Teal Deer JJ Talks Doesn't Understand Biology. In this video, we clear up a misconception that people have that all fetuses begin their life as a female. In reality, a human fetus begins its existence as something ambiguous, basically a middle point between male and female. The chromosomes that the fetus has, and subsequent hormone exposure, then determines how the genitals are going to form from that base middle set point. As a result of this, male and female genitals, despite looking very different, are actually ultimately basically extrapolations built from the same basic resources. The head of the penis, for example, is comparable to the clitoris. The flap of skin which covers the head of the penis, the foreskin, is thus comparable to the hood of skin that covers the clitoris. Now, there are obvious differences between the two: size, thickness, and indeed even the number of nerves within the skin. The point that I'm trying to make here is that although the structures are different, they're also quite similar, as a result of being constructed out of the same basic starting parts. And this brings us rather neatly on to why you can consider certain types of FGM to be comparable to male circumcision. Just like female circumcision, male circumcision also comes in a variety of types. The most obvious differences is high and low type, and this is determined by where the cut is made. High circumcision results in removing more of the shaft skin than low circumcision. This means that the cut is made usually more towards the middle of the penile shaft. A low-cut circumcision uses a cut that is much closer to the glands of the penis. So what you might be noticing here is the amount of skin being removed can vary according to the kind of cut being used. And this can be compared to type 1 and type 2 female genital mutilation. A cut removing less skin is more akin to type 1 FGM, if and only if the clitoris is not removed. A cut removing more of the penile skin is much more akin to type 2 FGM, which begins to remove parts of the labia, assuming once again that the clitoris is left intact, which in some cases in type 2 it isn't. And then there's type 3 FGM, which involves the removal of basically everything on the outside of the body and having it sewn shut so that there is a very tiny opening through which urine and menstrual blood can then pass. This doesn't really have a direct comparison in males, but the closest two procedures I could find that would give you an idea would be something called penile flaying or a penile subincision. Penile flaying has been recorded in Saudi Arabia and Yemen and is described as follows. The circumcision is performed not in infancy or childhood, as is usually done, but amongst the grown-ups who are about to marry. Unless the man is circumcised in this particular manner, he cannot obtain a bride. The circumcision is done with religious ceremonies as follows. The man who is to undergo the circumcision sends invitations to all his relatives and friends in his town and in the surrounding villages named above. A day is fixed, and the would-be bridegroom is taken up to a high building, open to view on all sides and specially erected for this purpose. He is well dressed like a bridegroom, the guests, males and females, together with other spectators watching him from below. The victim is made to stand with his right arm lifted, holding a dagger and looking straight forward with steady eyes. One Arab is appointed to watch the movements of his face and eyelids, and the operator, called Reyes or Kadim, commences the operation of circumcision at about 1 inch below the umbilicus, which is your navel or belly button, dissecting the skin downwards, peeling off the entire skin of the penis, leaving that of the scrotum intact, without any local or general anesthetic. If, during this operation, the man undergoing the circumcision even winks a little or shows any sign of pain of the operation, it is at once abandoned, and one of the following punishments is given to the victim. A. Killed on the spot. B. Deported from the district in disgrace. Or C. Sold as a slave to outsiders. Of course, the bride, for the sake of whom he was undergoing circumcision, is totally lost to him. Very often the would-be bride is also one of the spectators. The very commonly expected bad result of the circumcisions are hernia and urethral fistula, which is basically scar tissue that narrows the passage inside the penis. The latter is 1 in every 10 such operations. The deaths from sepsis are also very common. So penile flaying is similar in that it narrows the passages of the genitals at the end of the procedure, but it is dissimilar insofar as it actually allows the head of the penis to remain intact, whereas the female equivalent of that, which would be the clitoris, is removed. The only other thing that I could find that could be somewhat comparable was penile subincision. This one comes from Australian Aboriginal culture and involves the splitting of the underside of the penis along the urethra. In some cases, the cut being made so deep towards the glands of the penis that it would, in essence, cause the penis to become bifurcated. And there are several rather interesting explanations as to why this became a fashionable thing for them to do. Bettelheim suggested that subincision is an effort by men to acquire sexual apparatus and functions equal to women's, relying as they do on autoplastic manipulations, and knowing little about the internal sex organs of women, it may have seemed to primitive men that they might become bearers of children by equipping themselves with the organ through which childbirth takes place. Since primitives are unaware of a relation between menstruation and childbearing, and some of them ascribe inordinately high powers to menstrual blood, an effort to imitate this function might also be expected. This seems to happen in circumcisions and subincisions. Through both operations, the appearance of the penis is altered, but by subincision, it comes to resemble the vulva. In the repeated reopening of the subincision wound and the concomitant bleeding from the penis, the regularly recurring flow of menstrual blood seems to be imitated. Subincision also interferes with the ability to direct the stream of urine, and after subincision, men urinate in the squatting position women use. In most societies, next to childbirth and menstruation, the difference in function between the sexes is demonstrated most obviously by the difference in urination posture. It seems thus that in acquiring a vulva-like opening and in repeated genital bleeding, the most primitive men go furthest in making themselves like women. Rather tangentially, but also rather interestingly, this like women approach has another interpretation, in the form of the institution of boy wives, called chukadu if they're aged 5, or mulawanga if they're aged from 5 to 7, in the Kimberley region of Western Australia, where there is a particular sexual act where the boy's penis will be rubbed until it is erect, after which it will be inserted into the sub-incised elder's penis, who will then use that to stimulate themselves until they ejaculate. So whether it's a worshipping and impression of the female, or a method of homosexual intercourse, can be debated. Of course, the other explanation is that, since this is Australia after all, the Aboriginals simply noted that kangaroos have bifurcated penises, and their act of mating can last anything up to 2 hours. And so they may simply have believed that by bifurcating their own penises, it would make them last longer in sex. So once again, while this is not directly comparable to type 3 female genital mutilation, it does give you the idea that female genital mutilation is certainly not the only kind of genital mutilation out there in the world. There is certainly some very weird shit being done to boys and men as well, and in some cases being done to help them please women. So as you can see, this genital mutilation is not a one-way street. So now that we've got all of the really cringy stuff out of the way, the lads watching can uncross their legs, and we'll get back to the Oxford Against Cutting leaflet, because that's what started all of this. Why? Some people think they have to do FGM because of religion, but it's a practice that exists in cultures all over the world, regardless of religious belief. It has been passed down from one generation to another. Sometimes it is done to show that a girl is becoming a woman. Some girls are pressured to have it done so as not to bring dishonor to the family's name. FGM is often done to stop girls having sexual desires and protect their virginity. But as we've just seen, playing this all over the world card doesn't really stand up by itself. Boys. Does it matter to boys? It is important for boys to know about FGM because it can affect their mothers, sisters, and their own children. Everybody needs to tackle this issue together. Circumcision of boys is very different to FGM because of the reasons behind it, the risks involved, and the harm. Well, no. As we've seen, depending on the type of circumcision being used, they can actually be compared to each other pretty much word for word. As for other reasons, well, John Harvey Kellogg was a very big fan of mutilating the genitals of boys in order to stop them from having any sort of sexual desire. From his book, Plain Facts for Young and Old, page 106-7. Masturbation. In younger children with whom moral considerations will have no particular weight, other devices may be used. Bandaging the parts has been practiced with success. Tying the hands is also successful in some cases, but this will not always succeed, for they will often contrive to continue the habit in other ways, as by working the limbs or lying upon the abdomen. Covering the organs with a cage has been practiced with entire success. A remedy which is almost always successful in small boys is circumcision, especially when there is any degree of phimosis. The operation should be performed without administering an anesthetic, as the brief pain attending the operation will have a salutary effect upon the mind, especially if it be connected with the idea of punishment, as it may well be in some cases. The soreness, which continues for several weeks, interrupts the practice, and if it had not previously become too firmly fixed, it may be forgotten and not resumed. Through the courtesy of Dr. Archibald, Superintendent of the Iowa Asylum for Feeble-Minded Children, we have become acquainted with a method of treatment of this disorder which is applicable in refractory cases, and we have employed it with entire satisfaction. It consists in the application of one or more silver sutures in such a way as to prevent erection. The prepuce, or foreskin, is drawn forward over the glands, and the needle to which the wire is attached is passed through from one side to the other. After drawing the wire through, the ends are twisted together and cut off close. It is now impossible for an erection to occur, and the slight irritation thus produced acts as a most powerful means of overcoming the predisposition to resort to the practice. Rather interestingly, there's an excellent website that includes a timeline of medical circumcision in regards to males. And just reading off some of the things that male circumcision has been used to treat, well, it seems like it was basically used as a form of torture. But remember, male circumcision is not comparable to female circumcision because of the different reasons behind it. Well, let's just have a look at some of the reasons behind male circumcision, shall we? 1845, Edward H. Dixon declares that circumcision prevents masturbation. 1870, Louis A. Sayre publishes a paper proving that circumcision cures epilepsy. 1881, Maximilian Landsberg announces that circumcision cures eye problems that he believed were caused by masturbation. 1888, John Harvey Kellogg promotes circumcision as punishment for boys to discourage them from masturbating. 1891, Jonathan Hutchinson declares that the foreskin encourages boys to masturbate. 1894, P.C. Romandino says circumcising blacks will help prevent them from raping whites. 1900, Jonathan Hutchinson advises circumcision as a way to decrease the pleasure of sex and hence to discourage sexual immorality. 1926, Abraham L. Wolbast claims that circumcision prevents penile cancer. 1935, R.W. Cockshut demands that all boys be circumcised in order to desensitize the penis and promote chastity. 1941, Alan F. Guttmacher promotes mass circumcision as a means of blunting male sexual sensitivity. 1966, Masters and Johnson claim there is no difference in sensitivity between penises with and without the foreskin. 1969, Morris Fishbein calls for circumcision to prevent nervousness and, of course, also masturbation. 1985, Thomas E. Wiseman claims that circumcision prevents urinary tract infections. And this is just a few of the examples. Up until the 1980s, circumcision was being used as a cure for all sorts of wacky conditions and as a means of encouraging men to not masturbate, and to just generally try and make them more moral human beings. But yeah, all of those different reasons for female genital mutilation compared to male genital mutilation, right? And then in the 1990s is where you start seeing the really big turnaround. 1996, J.R. Taylor finds that the average amount of amputated foreskin was nearly half of the total penile skin. 1997, Edgar J. Schoen tries and fails once again to convince European countries to institute mass circumcision. 1997, Janice Lander discovers that circumcision without anesthesia is traumatic for babies. 1999, J.R. Taylor, after studying the foreskin specialized innovation, concludes that it is the primary erogenous tissue necessary for normal sexual function. And finally, 2007, M. Sorrells tests the relative sensitivity of the penis and finds that the foreskin is the most sensitive part of the penis, and the glans is the least. And before we get the mere cleanliness argument, there are several studies on this page that will demonstrate to you that circumcision in no way reduces your likelihood of getting STDs or HIV. If you want to take the dodgy studies at their face value that it does, then you must also agree that female circumcision does the same thing. But remember, the reasons behind all of this were totally different, and that's why we need to stop cutting girls' genitals, but not boys'. And finally, I'd like to end this by bringing us all the way round to the beginning again. Men, speak up to protect a girl at risk of FGM. It somewhat begs the question, just who's doing this anyway? Because this leaflet and many others like it, well, I'm just going to read the stories that they always publish. Waris Deary was about 5 years old when she was left in a makeshift shelter under a tree for several days to recover from her FGM. She still remembers her anger. When they tried to convince me that God wants this, I said, "Did my God hate me so much?" I remember telling my mother, "If he hates me, then I don't want him." In the days after FGM, many girls die from blood loss or infection. Deary says that she lay there talking to God saying, "Make me stay alive. You owe me this now. All my life I've tried to think of a reason for my circumcision. If I could think of a reason, then perhaps I would be able to accept what they've done to me. But I've never been able to find one, and the more I thought about it, the angrier I got. Female genital mutilation targets little girls, baby girls, fragile angels who are helpless, who cannot fight back. It's a crime against a child, a crime against humanity. It's abuse. It's absolutely criminal, and we have to stop it." A different case study. When I was circumcised, I was 5 or 6. It started as a ceremony. I was bought clothes, gold earrings, and bangles. I had henna put on my hands and feet. It was like a celebration, and I was the center of attention. The equipment they use is handmade, a sharp curved knife which is not sterilized, and I was given no anesthetic. They left a little hole for urination. There were no stitches, but they treated the wound with herbs, salt, and water. It bled a lot, and I was in great pain. I was horribly frightened and crying. And now another one. Amina's legs, arms, and head were held by female members of her family, so that she couldn't move. The circumciser used a sharp instrument like a razor blade or a knife to cut her. The sides of the outer lips were sewn together with acacia thorns. The opening that was left for urine, menstrual blood, and other bodily fluids was the width of a matchstick head. To stop the bleeding, the wound was covered with herbal mixture of ash, earth, sap, and leaves. When the process was over, Amina's legs were tied together, and she was taken to a room especially prepared for her recovery. During the first few days, Amina was given special food to stop her from going to the toilet too often, as it would be painful and could delay the healing of the wound. After 10 days, the ropes around her legs were removed, and she was asked to walk around carefully. They told her that if the opening was too big or had not healed well, the procedure would be done again. So notice something here. First of all, every single one of these case studies, and these are 3 different stories from 3 different organizations, they are all type 3 FGM that they're talking about here. All the most extreme circumstance, and it sounds horrible. There is no way around that and no denying that that is a terrible thing for anyone to have to go through. But only one of them touched on who was doing it, and that was the last one. She was held by female members of her family so that she couldn't move. And UNFPA.org, that's the United Nations Population Fund, sheds a little bit of light on this. Who performs FGM? FGM is usually carried out by elderly people in the community, usually, but not exclusively, women, designated to perform this task by traditional birth attendants. Among certain populations, FGM may be carried out by traditional health practitioners, male barbers, members of secret societies, herbalists, or sometimes female relatives. So notice, usually old people, usually, but not exclusively, women. Why some women choose to get circumcised. An anthropologist discusses some common misconceptions about female genital cutting, including the idea that men force women to undergo the procedure. What can foreign activists, as well as locals who oppose female genital cutting, do to curb the practice? For starters, Bettina Schell Duncan, an anthropology professor at the University of Washington, who has been studying the practice in many countries for years, suggests using the term cutting rather than mutilation, which sounds derogatory and can complicate conversations with those who practice female genital cutting. She also challenges some common misconceptions about FGC, like the belief that it is forced on women by men. In fact, elderly women often do the most to perpetuate the custom. I thought African girls were held down and butchered against their will, but some of them voluntarily and joyfully partake in the ritual. I thought communities would surely abandon the practice once they learned of its negative health consequences, and yet, in Schell Duncan's experience, most people who practice FGC recognize its costs. They just think the benefits outweigh them. This is a very good interview, and I encourage you to go and read it in its entirety, because I think if I tried to cut it up to put it into this video, it would actually do it a great disservice. But it goes on to talk about a few interesting types of circumcision, and gives one quite in-depth story about a woman being circumcised. And the story actually goes on to tell about how, just a few moments after getting it done, the woman is up and dancing and celebrating the fact that she's just been married. No painkillers, no drugs, and it's seen as a rite of passage. It should be noted that it is only a type 2 that is done in this story, not a type 3. But it's just an interesting counter-perspective to the constant narrative that we're having thrown at us in this country, that FGM is this constant terrible thing and is always awful. And I think it just adds an extra perspective to the overall topic, especially in regards to the fact that in the UK, female genital cutting of any kind is always seen as completely and utterly barbaric and immoral. In fact, it's illegal, and yet the cutting of male genitalia, while falling out of fashion and being reduced, is still completely legal. So to wind this up to a nice closing point, I don't think it's just men who need to be speaking up to protect a girl from genital cutting. I think we need to start looking at the actual root cause of the rising rates of FGM in the UK. In this instance, it's largely coming as a result of the large rates of immigration from Africa and the Middle East. And if you want to combat this effectively, maybe don't put the onus entirely on men. Maybe your next poster should reflect the reality of who is perpetuating this kind of behavior and be telling women that they should stop cutting their daughters.